Jodi, what's behind the recent flare-up of cases that we've seen in South Korea? This, I have to say, looks very familiar in terms of the clusters that are being seen. What are the authorities also doing about it?
Yeah, Heidi, this does have a feeling of some of us remembering what happened in February and March in South Korea, which was a country with an early flare-up, and at that time had more than 5,000 infections related to a religious sect. They became, at that point, the second worst hit by the virus. But the country has done a very good job, kind of a notable job worldwide in terms of testing and contact tracing, keeping their numbers relatively low overall, even with this recent flare-up. It's 15,000 cases and only, remarkably, 305 deaths. The concern this time is that this recent flare-up in the church, which does recall what had happened earlier, it's harder to contact trace and test these individuals. That's the worry of officials there, that this group could make it harder to test, which could trigger a wider community transmission. So at this point, they're trying to take steps to go to their strategy, which is that testing and tracing. And they're going to charge the pastor of this church for violating self-quarantine rules and failing to cooperate with requests for a list of parishioners who needed testing.
Concerns also about what's happening in Japan, despite the fact that we are seeing cases decline in Tokyo.
Yeah, so Tokyo's new virus cases slipped to 260 yesterday on Sunday, down from 385 on Saturday, and they had been having a flare-up. Yet the concern is that patients in their 20s are the biggest group of infections, accounting for 84% of the new cases, followed by people in their 30s. Earlier, this had been people, older people. The worry here, of course, is that this could spread. This caused the Tokyo metropolitan government to continue to keep its alert at the highest level. As they say, they're worried about this infection spread among all age groups.
What about the situation in India? What's Narendra Modi promising, and is it something that he can deliver?
Yeah, so India, which has now surpassed the UK, is the country with the fourth largest number of cases worldwide. So it's spreading very rapidly there, and a big concern. The Prime Minister has said that India has 3 COVID-19 vaccines under trial, and he will ensure that a vaccine reaches every citizen. He was paying tribute to those, as he paid tribute to those fighting the coronavirus pandemic. He also announced a national digital health mission to bolster India's healthcare system that's expected to include digitization of health records. Of course, the concern is how quickly can you come up with a reliable vaccine, even though they have vaccines under test right now, and also how do you get it to every citizen in such a populous country. But that is what he is promising at that point as the country deals with a real big spread of the virus.